Hi, in this video let's focus on various important topics and those topics which you need to focus on, right? So this I have gathered based on reviewing various previous entrance exams in the last 4 to 5 years, right? So starting with infection. So we have various categories in general medicine, infections, various systems like cardiovascular system, hepatic system, renal system, etc. So we'll go system wise and we'll try to focus on important topics in that particular areas, right? So in infections we have questions from the following topics, right? As you can see here, we have hepatitis E, question on hepatitis E in NEET 2013, and questions on viral hepatitis, HIV, influenza virus, swine flu, herpes labialis. So all these covering the viral infections. And bacterial infections, we have questions from Bacteroides fragilis, tuberculosis, sepsis, SIRS. SIRS stands for Systemic Inflammatory Response Syndrome, asked in PGI 2011. And also we have questions on the management of bacterial meningitis and tetanus, right? So in general medicine, usually we have questions either from the clinical signs and symptoms or even from the management aspect also, right? And coming to various other miscellaneous topics in infections, we have even questions from otomycosis in COMET 2012, and also we have a question on C-reactive protein, right? And coming to central nervous system, we have various topics, various important topics from which we have several questions in the previous 4 to 5 years, starting with Bell's palsy, asked in KSET 2012, and also we have questions on management of acute retrobulbar hemorrhage, asked in Karnataka 2013, and also cavernous sinus thrombosis. This was actually a case history in the sense in the question they have mentioned the signs of a person suffering from cavernous sinus thrombosis, and they have asked us to diagnose the condition, right? So asked in AAPC 2014. And also we have various questions from facial nerve lesions, lower motor neuron lesions as well as upper motor neuron lesions, right? So asked in PGI 2012 as well. And in gastrointestinal tract, GIT, we have questions from vermiform appendix, Kehr's sign, Morphy's sign, Rousing sign, various signs, and various causes of gastroesophageal reflux disease, GERD, in NEET 2013. And also we have questions from pancreatitis in COMET, diagnosis of H. pylori infections, various tests which are used in diagnosis of H. pylori infection, asked in AIMS 2014. And also we have questions from gastritis in PGI 2013. So on the acute version as well as on the chronic version of gastritis, we have questions. And in renal system, we have questions from glomerular filtration, various markers for glomerular filtration, asked in COMET 2016, last year. And also the reasons or the causes for urinary stone formations like oxalate crystals, etc., right? So these are some of the topics in renal systems. And in hepatic systems, there are several questions from jaundice, right? In COMET 2014 also we have one specific question on jaundice. And in endocrinology, we have array of questions covering these topics, HbA1c or glycosylated hemoglobin, which is used for evaluating the long-term prognosis of blood glucose estimation in diabetic patients. So more or less we have several questions from diabetes mellitus, starting from signs, symptoms, ending with the management, including oral hypoglycemic drugs as well as insulin. And also various causes of polyuria were asked in Karnataka 2013. And also there are questions on hormones like leptin in COMET 2015, and also questions on hyperparathyroidism in COMET, right? And coming to hematology, we have questions from iron deficiency anemia, sickle cell anemia, and also various lipid and thyroid profiles, like various values of the components in these profiles when the levels increase or when the levels decrease correspondingly, right? And in respiratory system, we have questions from bronchiectasis in Karnataka 2013 and on pulmonary fibrosis in COMET 2016. And in cardiovascular system, the most important of all the systems, we have questions from antibiotic prophylaxis. We have one recent question in PGI 2013, and also we have questions from jugular venous pulse or jugular venous pressure in AIMS 2013 on the waveform, right, on the waveform of JVP. And also we have questions from the cardiac output in AIMS 2013. Due to space constraints, I couldn't write all the topics in this particular area, so I have a few other questions or topics here. And in CVS, a few other important areas are management of hypertension, right? Emergency management and the conventional line of treatment for hypertensives, right? And also we have questions from rheumatic fever in PGI 2011 and also in Kerala 2015. And we have various questions from heart sounds and murmurs in KSA 2012 and PGI 2012. And also we have questions from atrial fibrillation in Kerala 2015, right? So these are some of the important topics in the cardiovascular system and few other miscellaneous topics. And we have also questions from the bone density classification, the MISH bone density classification in COMET 2013, which is used for treatment planning of implant placement. And also we have questions from ultrasonography in Karnataka 2013. And also we have questions from Advanced Cardiac Life Support ACLF Guidelines 2010. And the guidelines were framed in 2010, and we have one particular question from this topic in the recent exam. And also, as I mentioned previously, thyroid and lipid profiles, the questions were asked in AAPG 2015. I mentioned it here, right? And also we have few questions from INR, which is used for assessing the intensity of anticoagulation, the normal values. It's around 2 to 3. So we even have questions from that particular topic in the recent COMET 2016, right? So these are some of the important topics which you can focus on while you're preparing for NEET. And also remember, most of the topics which are discussed now were already covered in either micro or in pharmacology or in pathology or in even oral medicine, right? So there is greater overlap of various topics when you're preparing for general medicine. So that's an added advantage for you because that gives you confidence again. And also when you're practicing multiple choice questions or going through synopsis of general medicine, make sure that you have a standard textbook along with you, such as Davidson. The advantage, as I mentioned previously, you'll have authentic information, and also in Davidson the representation is so good that you actually feel like studying. The graphical illustrations, various diagrams, and also information is given in form of tables, which is actually very interesting, right? So these are some of the important topics which you can focus on in general medicine, right? Thank you.